Hi, my name is CC Demezier, or Chris, whichever works best for you. And I'm a women's health nurse practitioner with Simmonds, Martin, and Helmbrecht. So a question that I have today is, what is emergency contraception and what are some common misconceptions that people have about it? So emergency contraception is any type of contraception that's taken after an instance of unprotected intercourse with the intention of preventing pregnancy. So the most common forms out there are pills. You might have heard of Plan B or My Way. You may have even heard of Ella. So these work in a particular way to mess with ovulation. So they essentially inhibit or block ovulation from happening. And so some common misconceptions that people have is that the morning after pill or emergency contraception is considered an abortion. It's not. So the way that they work is that they mess with ovulation specifically. So their objective is to keep the sperm and the egg from actually meeting. And so if fertilization has already occurred, it will not prevent that. Or if that fertilized egg is now implanted into the uterus, it will also not prevent that. So in addition to the two types of pills that I mentioned, the Plan B or the Ella, there's also the copper IUD also is considered an emergency type of contraception. So let's talk about timing. So for any type of emergency contraception, the sooner you do it, the better. And so, for example, for things that have levonorgestrel, so that's things like My Way, Plan B, things like that, or even just the generic version of it, it's best within 3 days. The Ella, this one, however, does require a prescription. That one's good for 5 days. The IUD, the copper IUD, is also good up to 5 days after unprotected intercourse. There is some concept that folks that have an elevated BMI or an elevated weight, there may be a decreased effect with emergency contraception. So specifically with the levonorgestrel, so this is like the My Way or the Plan B, there is an idea that if someone is of a BMI of 30 or above or a weight of 165 pounds, that the method may not be as effective. And so in that case, Ella is the recommended one in the case of someone with an elevated BMI or of a weight above 165. Unfortunately, Ella does require a prescription from a provider. So it's a good idea the next time that you see your gynecologist or your GYN provider that you ask for a prescription just to have on hand so that if and when the need arises, you'll have access to either Plan B or Ella if you need. In terms of your period, any form of emergency contraception, with the exception of the copper IUD, will mess with when your actual period will occur. And so if you take a form of emergency contraception and you don't experience your period within 1 to 2 weeks after you normally would, I would take a pregnancy test and I would make an appointment with your OBGYN.